Welcome back to the Explainer. So most people know that Medicare Part A, that's your hospital coverage, is generally free for most enrollees. But what surprises almost everyone is that Part B is absolutely not. Starting the very month you enroll, Medicare is going to deduct a specific amount every single month directly from your Social Security check. And if your income is above a certain threshold, you could be paying significantly more. In this explainer, we're going to dive into exactly what Part B covers, what it costs in 2026, and the one major penalty that will literally follow you for life if you miss your enrollment window.
Let's just hit you immediately with a sticker shock. $202.90. Many new enrollees have never heard this number before, and it genuinely catches them off guard. Contrary to the popular belief that Medicare is just this totally free ride in retirement, this exact baseline amount is deducted directly from your Social Security check every single month, starting the moment you enroll. Okay, let's look at what we'll cover today. 1. What Part B actually covers. 2. The exact 2026 costs, including the monthly premium, the annual deductible, and the 20% coinsurance. 3. Who pays more through the IRMAA surcharge. 4. What Part B does not cover. And 5. The late enrollment penalty you absolutely need to know about. Let's get into it.
Section 1. What Part B actually covers. Think of Medicare Part B as your everyday medical insurance. While Part A covers you when you're admitted to a hospital, Part B covers the vast majority of your everyday healthcare. We're talking about everything that happens outside a hospital stay. Breaking it down, we've got 5 main categories. First up, doctor services. Every visit to your primary care doctor, every specialist appointment, and every consultation falls under Part B. Second, outpatient hospital services, which means tests, procedures, and treatments done without being admitted. Third is preventive care. Fourth, durable medical equipment. This means things like wheelchairs, walkers, blood sugar monitors, and oxygen equipment. If your doctor prescribes it, Part B covers 80% of the approved cost. And fifth, some home health services, like medically necessary skilled nursing visits and physical therapy ordered by your doctor, assuming you meet certain conditions. Now, jumping back to that third pillar, preventative care. This is literally one of the most underused benefits in all of Medicare. You're already paying for this, so please use it. Part B covers a huge list of preventative screenings: mammograms, colonoscopies, bone density tests, flu shots, and your annual wellness visit. And the best part? Many of these are at absolutely zero cost to you.
Section 2. The exact 2026 costs.
Now for the financial breakdown. Honestly, this is the section most people really wish someone had explained to them before they signed up. The standard Part B monthly premium in 2026 is $202.90. That's an increase of $17.90 from 2025, which is nearly a 10% jump in just one single year. For most folks, this gets deducted automatically from their Social Security benefit each month. If you aren't collecting Social Security yet, don't worry, you'll just receive a bill directly from Medicare. But here's the thing, that monthly premium isn't your only upfront expense. On top of the premium, Part B has an annual deductible of $283 for 2026. You have to pay this amount out of pocket once per year before Medicare steps in and starts sharing any of your healthcare costs. So what happens after you actually meet that deductible? Well, Medicare covers 80% of approved services, and you are responsible for the remaining 20%. Sounds manageable, right? But here is the massive financial risk. There is absolutely no cap on what that 20% can add up to in a given year. One major health event, and that 20% could easily become astronomical. This completely uncapped liability is exactly why so many people on original Medicare choose to add a Medigap supplement plan, specifically to cover that 20% and protect themselves from huge, unexpected bills. We'll actually have a full explainer on Medigap coming up soon. Section 3. The IRMAA surcharge. It's a simple fact. High-income enrollees pay more. If your income as an individual is above $109,000 per year or above $218,000 for a married couple filing jointly, you're going to pay an additional surcharge called IRMAA on top of that standard premium. In 2026, depending on just how far above those thresholds your income goes, your IRMAA adjusted monthly premium drastically scales up. It ranges from $284.10 all the way up to an incredible $689.90 per month. The crucial point here is understanding exactly how they calculate this. Medicare actually looks 2 years backward. Your 2026 premium is based entirely on your 2024 tax return. But actually, don't panic if your situation is completely changed. Let's say your income has dropped significantly since then, maybe you finally retired and aren't earning that big salary anymore, you have the right to appeal the IRMAA determination and get it lowered. Section 4. What Part B does not cover. Honestly, what Part B does not cover is just as important as what it does, because these specific gaps catch people off guard every single time. It does not cover routine dental care, routine vision exams or eyeglasses, hearing aids, acupuncture in most cases, or long-term custodial care. Dental, vision, and hearing are literally 3 of the biggest healthcare expenses in retirement, and Original Medicare covers almost none of them. Now, some Medicare Advantage plans do include these extras, which is a big reason people choose Advantage over Original Medicare. But if you stick with Original Medicare, you absolutely need to budget for these costs separately or look into finding standalone coverage. Section 5. The late enrollment penalty. Okay, there is one more thing you must know. This is easily one of the most irreversible mistakes in the entire system. The rule is simple, but it is brutal. If you don't sign up for Part B when you are first eligible, and you don't have a qualifying reason to delay, like being actively covered by a large employer health plan, you will face a permanent penalty. That penalty is 10% added to your monthly premium for every 12 months you were supposed to be enrolled but weren't. And yes, that penalty stays with you for the rest of your life. Let's look at how that math stacks up over time. Based on a $202.90 premium, being just 1 year late adds over $20 to your monthly bill permanently. 2 years late, that's over $40 permanently added to your bill every single month forever. This perfectly proves why the golden rule of Medicare is always, when in doubt, enroll on time. So let's wrap this up. We've seen that Part B covers your everyday medical care for $202.90 a month, or much more if you're a high earner. We covered the deductibles, the massive risk of that uncapped 20% coinsurance, and the heavy, lifelong penalties for enrolling late. But here is a thought I want to leave you with. If Part B's permanent penalty surprised you, are you fully prepared for the traps hiding in Part D? That's your prescription drug coverage, and it has its own set of incredibly complex rules that catch millions completely off guard. We're going to be doing a full explainer on that topic very soon to help you navigate those hidden rules. Until then, keep learning, stay focused, and I'll see you in the next explainer.